you asked the question, a very important question is, do I have any hope for things? And I'd say I do have hope. I think that one of the things I think this current generation has forced us to do is to ask those difficult questions that perhaps you and I didn't ask on a regular basis in training. Why is it that this calculation, why is it that my ASCVD score has African American listed as part of it and not social determinants of health as a real marker? Why is it that my calculation for my creatinine clearance that has race based inside of it, and we know that that's a social construct, as opposed to outlining characteristics of social determinants of health, right? Food insecurity, financial stress, transportation, things of that nature that we know begets bad outcomes with individuals. Why is it that when I look at, and then people say, well, that's old stuff, that's antiquated. But I always tell individuals that my job as a physician, our job as physicians is, first, we start off by looking at the current state. We call that the subjective. What's the chief complaint, the chief concern, right? Then we say the history of present illness, but we don't stop at the present state. What do, Joel? We go, let's look at your past medical history. Let's look at your past surgical history. Let's look at your family history. Now, why do we ask that? Because each and every one part of it is important for shaping the way we deliver care. So it's important to understand the background in any particular situation. So when you begin to dig and you understand the backdrop, you understand that redlining, it created these areas and these of zones that were disparate in terms of green environments, of trees and parks. They call these unincorporated areas near where I lived in Compton, California, that look like trucking zones, minimal parks and things of that nature. We had to actually drive to them. And so what we know now from this, we know that the heat index is much higher. We know that when there's a higher heat index, we understand the platelet reactivity is much higher. We understand the coagulopathy is much greater. We understand the burden of acute events is higher. Now, what we know too as well that happens in these areas, we have increased pollution. We also know that, and we understand the ambient air pollution, this air quality, what it does to our bodies and to our cardiovascular system too as well, of these communities of crucibles of conflict. Then we start to dig in and we say, okay, well, what about these areas these beautiful highways inside California, the 10 freeway, the 15, the 215, the 91, the 101, the 405. Well, these areas were taken by eminent domain to build highways, which we all find are beneficial, but they went through many communities of color that now they bisected them, exposing them to increased pollution, but not just pollution, noise. And so it's crazy when you look at studies out of Journal of American College of Cardiology, American Heart Association, that really tell us that increased noise levels, decibels of noise levels, that it equates to increased adverse events, that you activate the stress hormone cascade in the body. So we have individuals who are walking around in stressful states. And so when we say, can we easily fix this? It's going to take a collective effort for us to fix it. And we haven't even gotten to nutrition yet. That now that during the turmoil of the 60s, that what came in place, right? They always say the alcoholics say, like, my heart's too big, it has to be filled with something else when they move away from drinking. When you are devoid of anything, you have to fill it with something. So when the communities were decimated and they were now filled with what? Fast food companies with a higher profit margin, with liquor stores. Now you introduce these nutritional stress, oxidative stress ladled inside all the foods with advanced glycated end products and with, heterocyclic amines and all these different things from the grilling and frying. And it's just there pervasive. And that's the environment I grew up in. I remember as a child going with my dad before we had TikTok and we had Instagram and had cell phones. It was just like, okay, we're going out. Yeah, I'd love to go with my dad. And we would drive literally 20 some odd miles to a grocery store. And I remember walking in, it looked like I had gone to the Garden of Eden. You see fruit that would look ripe and the vegetables, and we go and get stuff. And he wasn't a perfect man, because then he'd have all of the processed chips and the TV dinners, didn't smoke or didn't drink, but had all the other conveniences that were there. And you juxtapose that with the food places that were in my community. And it was a stark difference with a price that was markedly different too as well. And so it's no surprise that we have disparities, and we haven't even spoken yet about the perilous impact of toxic stress of discrimination and hate and what that does in triggering the stress hormone cascade inside of a person. So it's no surprise to me that individuals who are of African descent, Latino descent, maybe different genders, sexual orientation, that there is a level of stress that they have that's aggregated. And that's what we're seeing. And so it's going to take a collective effort. It really, truly is for us to ever see it. But it is a collective problem because we're syncing with our healthcare system. Mm. And I believe it starts with our food. I do believe it starts with our food. We have to really turn our food system around. We have to go ahead and we have to look at really the foods that we're giving to our kids at a young age that can now increase their mental intellect, that allows them to succeed inside of life and the educational system, which I didn't even touch on any of that too as well. So there's a lot.
Wow. And that was one of the most eloquent, kind of global descriptions, and I don't think we can top that. I just add in, I'm very concerned about, lead exposure to children and IQ, and there probably are disparities in terms of older pipes and water systems and access to something as simple as turning on the tap and having a glass of water that doesn't lower your IQ by 12 or 32 points, which is all well documented, including our Mutual American Heart Association and the millions of people here that suffer hypertension from, toxic environments that they're living in and heavy metal exposure. So I don't want to take away from 5 million Kaiser participants that are waiting for you to fix all these problems. And, it's going to take generations, as you say. But I just want to thank you for sharing from your heart and sharing with passion and being part of the solution, not part of the problem. We got a long way to go, but God bless you, sir.
Yeah, well, listen, I appreciate you
and
all the work you do as well.
I only hope your wife, the story ended with a happy note, I hope.
Oh, absolutely. She's doing well. I'm not sure exactly what transpired with her. And my stance in life is always, it's not really, and I tell my kids, this is what I tell my kids. I don't care about your grades. I care about what you're doing. If you're on the phone, if you're playing games and you tell me you got a B minus, a C, a D, I care about your process. The process was broken to start off with. And so for me, the reason why it was a pain point for me, and my wife did well, thankfully, but the reason why I had to address it at a high level is because it's a process issue, right? It's a process. And you understand that from, if a person has a horrible technique and they jam a wire down the vessel and somehow they get open and the patient is okay, that was still a wrong. You have to correct the process. Right. Otherwise, it's guaranteed you're going to have a domino, just a massive onslaught, avalanche of problems in the future. And so that's something that I feel inspired that we have to do. I appreciate what you're doing in terms of bringing attention to the platform, not only of things like this, which are very challenging discussions for people who haven't walked through the shoes, but also really about the importance of nutrition that's there and all the work that you're doing. So I'll tell you, you inspire me. There's an old saying says iron sharpens iron. And so I always keep my eye on the sharpest point, which is the Joel Kahn out inside the Midwest there always.
God bless. All right. We can't top that. Have a good evening with your family and thank you for all your efforts.